Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everybody. My name is Linda Hughes. I'm Chair of Alberta Health Services Board, and I'm happy to welcome you here to the 7th Street Plaza, as well as those watching across the province on Facebook Live, thousands of them we know. I'd like to acknowledge we are gathered here today on Treaty 6 and Métis Region 4 territory, a traditional meeting place and home for many Indigenous people. We have a full agenda today, and our President and CEO, Dr. Verna Yu, also has a few words to share, as well as a video. But before we move ahead with the rest of the agenda, I'd like to congratulate the Diversity and Inclusion team at AHS for helping our organization earn national recognition from the Canadian College of Health Leaders. Next month, Diversity and Inclusion Program Manager Lead, Marnie Panis, will be in Toronto to accept the Excellence in Diversity and Inclusion Award at the college's National Health Leadership Conference. This is a welcome and well-earned recognition of the significant efforts of many people throughout the organization to create an inclusive environment that is fair, just, and respectful of all individuals. Whether you come to AHS for help and support, or whether you work at AHS, we want it to be a safe place where everybody can bring their whole selves, their real selves, to their work experience and to their healthcare experience. That's our goal. And yes, we still have work ahead of us, but this national recognition suggests that AHS is on the right track, and we're proud of that. Stroke care is another area where AHS is a national and international leader. Dr. Yu has often talked about the work of our world-class stroke program, and today, on the eve of Stroke Awareness Month, she has a video that captures the work of this program. But before I invite Verna to speak, does everybody have the agenda here? Could I ask someone to move approval of the agenda? Hugh, seconded by Marlis. All in favor? That's great, that's carried. Declaration of conflict of interest. Does anybody have a conflict of interest they'd like to declare at this time? Hearing none, we'll move along. You've all seen the minutes from our last meeting. Has anybody got any questions or issues to raise? Okay, could someone move approval? Glenda? Seconded by Brenda. All in favor? That's carried. Thank you. Over to you, Verna.
Thank you very much, Linda, and good afternoon to everyone. Alberta Health Services marks its 10th anniversary last month, and our people have taken this opportunity to do something that we don't often do in the forward-looking field of healthcare. And that's looking backwards and reflecting upon our accomplishments over the past decade. There are many achievements I could highlight today, but I'd like to focus on our provincial stroke program because it really underscores what we've tried to do at AHS. That is to ensure that all Albertans benefit from the expertise, equipment, and resources that we have within our province. Over the past decade, our stroke program has worked with healthcare providers from across the continuum of care, including EMS and emergency department teams, in order to coordinate safe, prompt, and seamless stroke treatment for patients wherever they are in the province. We want to make sure that if you live in a rural or remote community and have a stroke, that you will receive an equivalent level of care as someone who has a stroke in the city. And that's exactly what Andre Theriault and his family experienced when Andre had a stroke on his farm, located 65 kilometers south of Peace River and more than 400 kilometers from a primary stroke center in Edmonton. I have a video of their story that shows what our stroke program looks like through the eyes of our patients and families. So please take a look.
We moved to this house, I was 2 years old. My father had cattle and grain. At the age of 16 years old, my father fell sick. My older brother and I took over farming for him. Now my son and I farm 6,800 acres. So I came to the kitchen to have a glass of water, and then I was even worse.
I walked into the house and he was standing at the counter and disoriented, I guess you would say. And
he said, "Boy, have you been drinking this morning already or what?" And I said, "No, there's something that's not quite right there."
That's when I noticed that the face was dropping, and so I phoned 911.
And then in Peace River, then my body really started losing couldn't move half my body anymore.
That's when they did the CAT scans and stuff and seen that there was a blockage.
I said, will I be in a bed for the rest of my life?
Well, lose him or have a husband that's, you know, handicapped and
you don't know the outcome, eh? So it's scary, very scary.
And the doctor on call was continually on the phone. And my older son was getting a little upset because he's not even taking care of Dad. But unknowingly, the doctor on call was on the phone with Dr. Buck.
I was able to identify that from the description I got from the ER physician that he was suffering from a stroke, and from the CT and CT angiogram I was able to see that one of the main arteries in the back part of his brain was almost entirely blocked off.
Dr. Buck decided that yes, it was a clot stroke, and yes, give him the blood blasting medication. And it didn't take very long after that. When they gave him that shot, the symptoms just, he calmed right down.
But they medevaced me right away to Edmonton as soon as they stabilized me and everything. And
the nurse, before we left the hospital, of course she could see that Andre was very upset and scared, so she took him and said, you know, don't worry, you are not going to die today.
Each one of my patients is special, and I guess that's what inspires me to give those words of encouragement.
Hi.
Hello.
How are you?
Most excellent.
His brain rewired somehow, and his farming business is still top notch. He's able to do all his business deals, and he does his own bookwork.
We've worked over the past several years on creating an integrated network right from the pre-hospital stage to the emergency room and beyond, to ensure that rural stroke patients have as close as possible access to the same care as someone that is having their stroke, across the road from a hospital.
It's nice to know that there are protocols in place for us that live so far from major centers.
I think his outcome is a reflection of those types of quality improvement processes.
Luckily, I mean, the right people are there to handle the situation.
Did you ever know that you were going to have a miracle happen in your life?
No.
Together, we do amazing things every day.
We know that every single minute is important in stroke treatment because every minute that is lost means that you lose 2 million brain cells. Alberta used to average 70 minutes, 70, from diagnosis to treatment with a clot-busting agent. Now, thanks to the work of our Cardiovascular Health and Stroke Strategic Clinical Network, we average 40 minutes. That's an improvement few other health systems in the world have been able to achieve, and it gives stroke patients like Andre every opportunity to recover. Our provincialized model of healthcare delivery enables AHS to harness the resources, equipment, and expertise of healthcare teams across Alberta for the benefit of all Albertans. And that's what makes stories like Andre's possible. And that's what gives AHS the ability to respond quickly and effectively to emergency and disaster situations like the one we're seeing unfold in northern Alberta and affecting air quality in the Edmonton area and in central Alberta. I'd like to express my deep gratitude to all of our dedicated staff physicians and volunteers who have come together this month to support Albertans affected by the northern Alberta wildfires. In High Level, we evacuated 20 patients from the Northwest Health Centre on May 20th and safely relocated them to health facilities in Fort Vermilion, La Crete, Grand Prairie, Fairview, and Peace River. Days later, heavy smoke prompted AHS to evacuate 19 patients from the Community Health Center in Manning and relocate them to health facilities in McClellan, Fairview, and Beaver Lodge. And last night, we evacuated the Wabasca Des Marais Healthcare Center, relocating 4 patients to Boyle and Athabasca. Staff in Wabasca has been evacuated with EMS remaining in the community as long as it is safe. And with Slave Lake on an 8-hour notice, AHS is developing plans to evacuate our facilities there if there's need. However, high-level staff are now returning to the Northwest Health Center, which is expected to reopen later this week to support the community when it is safe for the public to re-enter. Despite the increasing threat posed by the wildfire and smoke, our people in Manning are continuing to provide safe and high-quality care to patients, residents, and their families in extremely challenging circumstances. Staff from public health, addictions and mental health, Indigenous health, and other areas are providing support at evacuation reception centers in Fort Vermilion, La Crete, Peace River, Slave Lake, High Prairie, and Grand Prairie. Meanwhile, AHS continues to work closely with our partners in the Municipal Emergency Operations Center and Provincial Operations Center as the wildfire situation in northern Alberta evolves. I'm proud of our AHS teams, but I'm not surprised by their efforts. Over the years, our teams have shown remarkable commitment and dedication during harrowing events, such as the Fort McMurray and Slave Lake wildfires, the southern Alberta floods, and the H1N1 pandemic, and will continue to do so as we face multiple fires throughout the north this spring. It's during times like these that we best see the strength of our provincial healthcare organization. This is teamwork in action, and we come together to help. When Albertans need us, we are there. I would like to thank all of our teams involved in both the evacuation of the high-level Manning and Wabasca facilities, the ongoing emergency response in northern Alberta, and the care of patients transferred to the other AHS healthcare facilities. I would also like to thank our staff who are at the reception centers and supporting those who have been forced to leave their homes. I'm very proud to lead this organization and work with people who regularly go above and beyond the call of duty for Albertans, whatever they need, wherever they live. So thank you very much for your time this afternoon.
Thank you, Verna. Now moving on to the next item on the agenda, Governance Committee. Hugh?
Thank you, Madam Chair. The Governance Committee last met on May 2nd of 2019. The committee received the Ethics and Compliance Office Q4 2018-2019 report for discussion and met with the Chief Ethics and Compliance Officer. The committee also received the annual 2018-2019 policy report highlighting the corporate policy work of the Policy Services Department. The committee received an update on the status of the 2019 Accreditation Canada assessment and considered the mandate and roles document and a template for the upcoming evaluation survey. There were no items coming before the committee that are recommended for board approval at this time. Thank you.
Thank you, Hugh. Community Engagement Committee. Brenda?
Thank you, Madam Chair. The Community Engagement Committee met on May 15, 2019, and the chair of the Yellowhead East Health Foundation attended the meeting. The committee considered 2 items for recommendation for approval of the board with respect to appointments of trustees to foundations and appointments and renewals of members to advisory councils. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care in the province. Given the number of appointments and renewals, the names will not be read in this meeting, but they will be incorporated into the minutes of the meeting and posted publicly. The responsibility to appoint trustees to established foundations lies with the AHS board. The committee recommended the board approve trustee appointments as reviewed by the committee. The board has considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations as reviewed by the board effective June 1, 2019 for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Could I have a seconder? Richard? All in favor? Okay, that's carried. Thank you.
The committee also considered appointments and renewals to advisory councils. The responsibility to appoint or renew council members also lies with the AHS board. The committee recommended the board approve the member appointments and renewals as reviewed by the committee. The board has considered such recommendations, and accordingly, I move that the Alberta Health Services Board approve the appointment and renewals of members to the advisory councils for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Seconder? Hugh? All in favor? That's carried. Thank you. Quality and Safety Committee, Glenda?
Thank you, Madam Chair. The Quality and Safety Committee met on May 22nd of this year. The committee's meetings generally focus on the 3 areas of access, quality, and safety. At our May meeting, the committee received a data analytics presentation on capacity. We considered a discussion on our diagnostic imaging strategy. We discussed the roadmap for strategic clinical networks, and we received an update on the implementation of the National Surgery Quality Improvement Program. We also received updates on quality and safety metrics in some of our regular board reports, and the committee also received a comprehensive update on the continuing care quality plan. There were no items, Madam Chair, recommended for the board approval.
Thank you. Finance Committee, David?
Thank you, Madam Chair. The Finance Committee met on May 23rd. The committee considered 3 items for recommendation for approval of the board. First, the 4th quarter investment report. As mandated by AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. The Regional Health Authority's regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. The committee was presented with the 2018-19 4th quarter investment report and recommended that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio transactions described below as certified by signed investment compliance certificates from AHS and Phillips Hager North Investment Management. A, as at March 31, 2019, Alberta Health Services held restricted and unrestricted funds managed by Phillips Hager North Investment Management and Manulife Financial totaling $1.698 billion. B, the funds are invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, and Canadian and global equity funds. And C, all of the funds invested during the quarter ended March 31, 2019 are invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager North Investment Management. I so move.
Thank you, David. Could I have a seconder? Glenda? All in favor? It's carried. Thank you.
Next, the committee considered 2 amending agreements which the committee recommended board approval in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. First, with respect to an agreement with Touchmark at Wedgwood, Edmonton, Inc. The board considered such a recommendation. Accordingly, I move that the Alberta Health Services Board, A, approve the amendment to the Touchmark at Wedgwood, Edmonton, Inc. Master Services Agreement to extend 32 long-term care spaces for 14.5 years to align the services with existing spaces at the facility, and B, delegate signing authority of such amendment to the President and Chief Executive Officer. I so move.
Thank you. A seconder? Marlis? All in favor? Carried. Thank you.
Second agreement is with Integrated Life Care, Inc. The board considered such recommendation. Accordingly, I move that the Alberta Health Services Board, A, approve agreements to and restate the Integrated Life Care, Inc. Legacy Agreement to the Master Services Agreement, which will include an extension of the supportive living and long-term care services provided for 2 years to align the services, and B, delegate signing authority of such amendments and restatement to the AHS President and Chief Executive Officer. I so move.
Thank you. A seconder? Glenda? All in favor? That's carried. Thank you. So David, now Audit and Risk Committee.
The Audit and Risk Committee met on May 23rd and this morning on May 30th, 2019. Standard practice is that the Office of the Auditor General and KPMG are guests at the meeting in their role as external auditors of AHS. On May 23rd, the committee reviewed drafts of the annual report and year-end financial statements. In addition, the committee received the Internal Audit and Enterprise Risk Management Annual Performance Report. On May 30th, the committee received the Auditor General Report for the year ended March 31, 2019. The committee received 2 items to consider for recommendation for board approval. First was with respect to the final draft of the AHS 2018-19 annual report, and recommended that the Alberta Health Services Board approve the annual report. Accordingly, I move that the Alberta Health Services Board A approve the AHS 2018-19 annual report in the form reviewed by the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and B, authorize and direct management of Alberta Health Services to deliver the annual report to the Minister of Health and to later make the annual report available to the public through the Alberta Health Services website. I so move.
Thank you. Could I have a seconder? You? All in favor? Carried. Thank you.
Secondly, the committee reviewed a final version of the March 31, 2019 consolidated financial statements, the establishment of internally restricted surplus for future purposes, and the financial statement discussion and analysis. The committee recommended the board approve those items. Accordingly, I move that the Alberta Health Services Board, firstly, approve the internal restriction of A, $940.283 million to represent the amount of unrestricted surplus invested in tangible capital assets as at March 31, 2019, and not available for any other purpose. Secondly, approve the internally restricted surplus for future purposes as at March 31, 2019 of A, $112.508 million to represent the amount of unrestricted surplus related to ancillary services. B, $21.568 million to represent the amount of unrestricted surplus related to insurance equity requirements, not available for any other purpose. C, $42.816 million to represent the amount of unrestricted surplus related to foundations and not available for any other purpose. D, $40.334 million for other defined initiatives. Thirdly, approve the AHSA consolidated financial statements for the year ended March 31, 2019 as reviewed by the board. And B, financial statement discussion and analysis for the year ended March 31, 2019, both for inclusion in the AHS 2018-19 annual report and both in substantially the form reviewed by the board with such non-substantive changes that management of AHS considers necessary or advisable. And fourthly, authorize and direct management of AHS to deliver the consolidated financial statements and financial statement discussion and analysis to Alberta Health and to later make them available to the public through the Alberta Health Services website. I so move.
Thank you. Could I have a seconder? Glenda? All in favor? That's carried. Thank you. And now over to you, Marlis, for the Human Resources Committee report.
Thank you, Madam Chair. This will be brief. The Human Resources Committee met yesterday, May 29th, 2019. The committee received a standing quarterly report on our people results and a labor relations update. The committee also discussed work with respect to workplace health and safety and the status of the e-people program upgrade. There were no items that came through this committee for board approval.
Thank you very much. And with that, we come to the end of our agenda, and I declare the meeting adjourned. Thank you all.
Together, we do amazing things every day.